Okay, my name is Stacy Pitts, and I'm the founder of CBD BioCare. And joining me today is Dr. Frank Michalski, who is a chiropractor in Buffalo, New York. Dr. Frank, thanks for joining us.
Oh, more than happy to be here. My pleasure.
So the reason we wanted to bring Dr. Frank into the conversation is because he has been providing CBD BioCare to his patients for quite some time now, and he's having great success. So we wanted to share his story and really explain why he chose CBD BioCare and what kind of results, more importantly, that his patients are receiving. So, but let's first understand who you are as a practitioner, Dr. Frank. So give us a little background about who you are and a little bit about your practice.
Yeah, of course. So as you said, my name is Dr. Frank Michalski. I'm a chiropractor located in Buffalo, New York. It's very cold in Buffalo for those of our viewers who don't know where that is. So we've had a practice now. This is our 6th year in practice, and we started working with CBD BioCare probably about a year and a half ago. I personally had success with CBD BioCare for neuropathic pain, so numbness and tingling in the hands and the feet. Once I realized how well it worked, I figured this is something that I have to start to share with my patients. So slowly, I started to look into the research when it came to CBD oil, and it fit our practice model really, really well. We're not your traditional chiropractic office. Most people think of chiropractic and they think of crack your back in and out the door. We are affiliated with a pretty large wellness facility in the area. So we provide typical chiropractic care, decompression therapy, cold laser therapy, but we also do a lot with wellness. So we do a lot with exercise rehabilitation. We do a lot with nutrition, focusing on helping people get out of pain using anti-inflammatory diets, using exercise, using supplements. For those of our viewers who are familiar with it, we are certified in something called functional medicine, which just tries to look at the body as a whole. Instead of saying you just have back pain, let's just focus on that one area of pain. We try and look at the body as a whole. So as you could imagine, CBD oil for me was really a natural fit because, as we're going to be discussing, it kind of addresses the body as a whole. So it's a little bit about what we do here. We're a multifunctional clinic.
And why did you choose CBD BioCare?
Yeah, realistically, so this is a funny story. So I was actually, again, searching for myself. I was hearing all this information out there on CBD oil. I had done some of my own research on it, and I just couldn't really figure out what exactly CBD oil was best for, right? So I knew for myself that it was something that I personally wanted to use and deal with. So from that standpoint, CBD BioCare kept popping up over and over again. And you know what, Stacey? I have to put you on hold, unfortunately, for 1 second, okay?
That's okay.
My apologies. Yeah. Thank you. Yeah, Michalski. Yep. So, Stacey, CBD BioCare, I actually found you guys online. You guys popped up with some of the best consumer reviews that were out there. And realistically, what do people do these days? They look at consumer reviews, right? I worked in supplements for 9 years before I connected with you guys. I worked at a vitamin store part-time when I was in school. And really, one of our best gauges for products was feedback from the consumers, from the customer. And you guys, quite frankly, were the first ones to pop up, and I started working with you. I saw instant results, and there was really no need for me to turn back at that point. Once I learned more and more about your product and the quality of it, the third-party testing, domestically grown, organically grown, the dosages and the concentrations that you had, I noticed very quickly that your product wasn't watered down with other carrier oils, with other ingredients. So it was a good fit. It was a good fit.
Well, of course, we have been more than happy to have you, partner with our company because we love working with practitioners because patients trust their providers, right? And so that's a nice match and mix, if you will, because it's still new to the marketplace. So when we have practitioners like yourself who have done the research and understand the science of the body and can explain that to patients, it's a win-win. So explain to us what type of results. We know you received results, but what have you been seeing over the past year and a half with your patients?
So that's a great question. And realistically, the main area that I kind of wanted to focus on, pain relief, right? That's one of the biggest things that we get people coming in our door for, our patients, right? They're seeking pain relief, whether it's for back pain, shoulder pain, whatever it may be, numbness and tingling. That's what they want. So when I dove into the research about CBD oil, and I'll kind of talk about some of that briefly right now, when you discuss pain, there's really three categories of pain that we see walk in our doors. You have acute pain. This is the individual who just rolled their ankle, they sprained their back shoveling, right? A muscle strain. Then you have more chronic pain or neuropathic pain. So this might be that person that has pain from like diabetes, right? Or they have numbness and tingling all over their body from really irritated nerves. Then you have another category of pain called centrally mediated pain. These are the patients that we see that come in who have Parkinson's disease, or they have multiple sclerosis, or those really, really bad autoimmune type diseases, right, that we think of. So there's really three categories of pain. And when you look at CBD oil, either topically or orally, it addresses, or there's areas of research to show that it can address each of those aspects of pain. So for us, in our clinic, we work with a wide range of patients, your simple sprain strain, all the way to your patient who has full-blown MS and who needs all types of rehab, right? So for us, the CBD oil was a great fit. Now, overall, I can tell you, like, day-to-day with the pain cream, that's a no-brainer. For those sprain strain injuries, for the golf season's going to be around the corner here in Buffalo, not too far from now, golfer's elbow, tennis elbow, we put the cream on the skin topically, and I'll tell you, it's within 5 minutes. By the time they're leaving, they're asking me if I sell it, if they can purchase it from me. And I experienced similar results. I play golf a lot. I had bilateral, epicondylitis, and within 5 minutes, the pain was almost completely gone. And the duration of relief that my patients report, 5 hours, 6 hours. It's really a lot longer than some of the other products that I see on the market that people are trying. So the cream was an instant one. The oral solution that you guys sell, I think the biggest impact we saw with people was like our fibromyalgia patients, our MS patients, right? Especially the fibromyalgia, I could say. We started using it with patients in that micro to standard dose, anywhere from 10 to 100 milligrams. And these fibromyalgia patients were coming in saying, hey, listen, I tweaked my back, but I noticed my whole body didn't flare up. Or if it did, that flare up seemed to be a much shorter duration of time. And when you look at the research, there's a lot of literature to explain why these patients are reporting those really fantastic results. I was excited when we started using it. Selling supplements for 9 years, people would come back and I would say, how did it work? How are you feeling? And they'd say, I think I'm better. I think I notice a difference. With the CBD oil, when it works for people, they're saying it without a doubt. They're saying, no, this is making a change. This is changing how I feel. I'm sleeping better. I have less pain. I have less anxiety. So that for us was just a great thing to see. A great thing to see.
And what's so nice that we hear too is that I've had other physicians report, and then we've just seen it ourselves, is that people will say, I was really taking it for sleep, but what I realized is it helped me with pain. Or I was taking it for pain, but what I realized it really helped me with is sleep. So I tell people that cannabis works 100% of the time. Not always exactly what you want it to work for, as much as you want it to work for, right? But it's about experimenting and finding out what serving size, how much works for you. And let's talk about that for a minute, because there is some experimenting. Some people, I've had them sit in my office and I literally let them try it. And they say within 10, 15 minutes, like, my back that always is hurting me doesn't hurt. But there is, for most people, a little bit of an experimentation. Explain how you walk patients through that process so that they don't give up or they don't lose hope that it will work. Because, the traditional pharmaceutical drugs, you take the pill and you get a pretty instant result normally. So explain how you walk patients through that process.
Of course. So I think, and this kind of goes to your first point. So I'm just going to use an example of a patient, right? So Let's say we have that fibromyalgia patient with back pain, but really their whole body hurts, they get flare-ups. Right now, if our listeners have any familiarity with fibromyalgia, and I think this goes for most patients who are in pain, typically they're suffering from insomnia because the pain keeps them up at night. Now, of course, if you're not sleeping, your muscles aren't recovering, so you're going to have more pain. Eventually, that's going to lead to some depression, right? Now, perhaps the same patient has recently become unemployed due to discomfort day to day. Of course, that's going to result in some anxiety. And God forbid, maybe they've developed an addiction in the meantime, perhaps to opioids, something else. Even over-the-counter medication, we see it where people are hooked on Aleve, Tylenol, acetaminophen, things like that, right? So just taking that into account, your typical pain patient usually does suffer from insomnia, anxiety, depression, and pain, of course, right? Those are the top things. So when I speak to a patient, I tell them, listen, we're going to give you this CBD oil for pain control to help with the pain. But you have to be aware it might impact your insomnia. It might impact the depression. It might lessen the anxiety. And we tell them to start at a really low dose for that reason, because the effects of a full spectrum CBD oil are so broad, right? So we usually start patients at a lower dosage. We'll usually start around 10 to 20 milligrams, depending on the condition. And then we'll have them start to work their way up. We'll usually do a week at, let's say, 20 to 40 milligrams for the first week, once or twice a day. And then I'll ask them, I'll follow up with them. How are you feeling? Are you noticing a difference? And they're saying, I'm sleeping better. I'm not sure I'm feeling less pain, but my sleep is definitely better. And I think my mood is better too. I seem to have a lot more energy during the day, right? And I say, that's excellent. That means it's working. It's having an impact. Now let's see if we can tweak that dosage to positively benefit the pain that you're feeling, right? To reduce that pain. So then we'll start to creep up on the dosage a little bit. And usually we'll double it. If they were doing 20 milligrams, we'll bump them up to 40. If they were doing 40, we'll bump them up to 80. And we'll go all the way up to about, I'd say in my offices, we don't have many people using over 200 milligrams a day. I would say that's rare if we do, but we'll just slowly work it up. But I can tell you, it's really that beginning conversation with them saying, this takes time to work. This takes time to build up in your body. And I'd be more than happy to have that discussion, how it works with you guys today, but we really try and educate them on how CBD oil works in the body, right? So we tell them, your body makes its own cannabinoids. And one of the theories behind fibromyalgia is that these patients have lower levels of endocannabinoids, cannabinoids made from within, all ready to start. So we tell them, listen, we have to build up this dosage to get your body's endocannabinoids increased. And I say that might take time. That might take trial and error. And it really does from experience. I could have, a 275-pound male with fibromyalgia who says he gets relief with 10 milligrams a day. And then I typically notice higher dosages are necessary in females, especially if they're past the menopause age. And there's some research trying to show estrogen probably plays a role in that. That female might require 100 milligrams a day to get the same relief. So we really just try and tell patients, work with us, give this some time. As long as we're not seeing any type of negative response, which is rare to never, we're gonna do our best to sort it out. But it's all about that sweet spot, right? At too low of a dose, it's not gonna work. At too high of a dose, we don't want to go there because it might have some of the opposite effects on sleep, right? It might give people a little too much energy sometimes.
Right.
So we try and find that perfect dose for our patients. And it's really, in my opinion, it comes down to the education. We tell them, watch the video on your website about dosing. We spend half an hour explaining it to them. So I think the education is the biggest part, getting them to hang in there.
Right. And I love that because it's about giving people confidence that this product does work, but it's a matter of understanding how it's going to work for them. And the other thing I tell people is that, especially the first month, it's experimenting. It's like there's pharmaceutical drugs out there, especially for blood pressure, that are an experiment. Well, this is the same type of thing, but in a much healthier way. And a lot of times, and tell me if you disagree with this, but after some time passes, they can actually reduce the amount that they're taking once they find that sweet spot.
So this was pretty fascinating. So when I first started working with you guys and I didn't know much about it, I knew it, I wasn't scared of it. So I was like, I'll take it. I don't have a problem with that. I found over time it was awesome for sleep, pain control, everything. And I was like, wow, this is really working well for me. And maybe over a period of, let's say, 5 or 6 months, I was taking the same dose and it just didn't seem to have the same effect. The pain was still under control. Energy seemed to go down a little bit. I was like, it doesn't seem to be the same. I actually reached out to your company. This is early on. This was probably, like I said, about a year and a half ago. I was like, hey, do you guys have some advice? It seems to be a little different. And the advice was start to take less. And when you look at the research, that makes sense because taking CBD oil helps your body make more of its own cannabinoids, right? So in theory, if you're taking it, over time, your body should be producing more of its own naturally. So you should need to take less and less of the CBD oil. And I can say I had that experience and many of our patients have that experience. And that's a key point because they're so excited to be taking it. We sometimes tell them, listen, I actually think a little less is actually what you need at this point. They're like, oh, I don't want to take less. It's like, it's okay. It's working. It's doing what it's supposed to be doing. We're on the right track. And then they do. And, I think the hope is that eventually people need a really, really small dose. Or, I would have nothing wrong if someone said, hey, it worked, it did its job, and I feel good now until next time, So I would completely agree with that.
It's counterintuitive, really, right? So it's interesting. It's that we tell people that all the time. Sometimes less is best. So it's interesting to hear. After so many years of talking to people and hearing different stories and working with people, you really start to understand how fantastic this product is. And what it does best is create balance in our own bodies. So whatever's out of whack, whether that's sleep or you're getting the pain from inflammation or whatever the case may be, it does a good balancing act. And once you bring it in balance, then again, you're taking less as opposed to taking more, which is a relief for people because the idea is to keep you on this product, but not taking too much because you don't want to run through it in a month and be gone, because it can be more expensive. So I love that you work with your patients to help them get exactly what they need and not any more or not any less. So that's great news.
And getting to that maintenance dose. And if, I find that, because that was what I kept hearing, right? So it brings the body into balance and homeostasis. And I'm like, that's great, but I want to know how. Like, why is that happening? And when you look at the research on it, and I'll just throw this out there because I would encourage people to read about it. But we explain this to our patients. We say, your body makes its own cannabinoids. And when you look at the literature on how CBD balances the body, what it seems, and you might agree with this, what they're finding is people with fibromyalgia, people with addiction issues, people with insomnia issues, they have an enzyme in their body called FAAH. And that enzyme destroys your body's own cannabinoids. When you take CBD oil, it blocks that enzyme, allowing your body to slowly start making more of its own until you hit that balance. So once you kind of understand that, it's like, of course, this is why I'm needing less over a period of time, eventually getting to that maintenance dose. And when we talk to all their physicians, that's really, we've created a lot of excitement here in Buffalo over it. And that's really where they're interested. They're like, wow, that's fascinating. That's and that's similar to how over-the-counter pain medications work, except without all the side effects. So what could be better, right? Instead of destroying your gut, this is actually potentially really good for your gut. The gastroenterology community is taking a huge interest in this. So it's exciting.
It is exciting. And before we wrap up here, we're going to continue the conversation with you and continue to do these interviews to where we can share your information and your experience. But before we close, I'd like to ask you about, when do you not recommend CBD? Is there something in particular that people that are watching this should know about when maybe they're not a candidate?
Yes, so I want to emphasize one thing that we don't do. And now let me be clear, there's a ton of benefit that's coming out of the literature when it comes to CBD and cancer. If people are on really heavy hitting drugs, really strong anti-seizure medications, really strong chemotherapy, really strong cancer drugs, sometimes really, really heavy doses of blood thinners, I don't tell that person that they're not a candidate. I just say, listen, we have to work closer now with your oncologist, with your, neurologist if it's for a seizure disorder. And I'll be honest, most doctors are pretty open to it. It's almost impossible to ignore now, whether you're on the holistic side or the traditional side. It's impossible to ignore. So those are cases where I'd say I approach with caution. I can say over the course of the last year and a half, I've maybe had 2 patients where we really worked a million different dosages, a million different ways, and we just couldn't get it right. They just weren't reporting the results that I wanted. And after about 2-3 months of really working closely with them, I said, listen, I don't think this is going to be the solution for you. Down the line, as we get more research, perhaps we'll revisit it. But it's been very infrequent. But really, it's mainly with those patients on very, very heavy hitting drugs. That's where I get concerned. Your day-to-day stuff, we're not too worried about. It's a little easier for us being a physician to know the interactions and how things work. But again, really, I'd say like the chemotherapy, radiation patients, which they're using it with those patients. We just like to really work closely with their physicians when it comes to that. That's the only case. But that's the only time I'm not jumping the gun and saying, oh, just take this for whatnot. That would be the main one though. Of course, too, I would say, again, we see a huge benefit. We have 2 schizophrenic patients who benefit quite a bit from this. But when there's, let's say someone has a lot of really intense mental health issues and they perhaps been in and out of a psych ward, something like that, those are also cases where we're just very, very cautious, right? Because we want to give them a really low dose to start and then work the way up, because we wouldn't want it to flip them the opposite direction. So most all the time you can use it. Some cases you just want to be more cautious. That's all.
Yeah, absolutely. And if you are one of those people that are on heavier medications, it's always a good idea to run a new supplement or whatever you're thinking of using. It's always a good idea to run it by your practitioner, the person that is closest to your care. So that's great advice. I really appreciate your time today. Is there anything else that you'd like to add before we close up?
No, I don't believe so. I think the other biggest thing that people have to understand is when people have tried it before, because there's so many products on the market now, right? And you guys send out emails about this all the time, but you have to watch out for those lower quality products because it hurts the name of CBD, right? Someone buys a hemp oil that actually has from the seeds and no CBD in it, and they say, oh, I tried it, it didn't work. I'm disheartened to see that because I look and I'm like, there's actually only 1 milligram of CBD in here, if that. And realistically, we're recommending 40 milligrams a day for you. So of course it didn't work. So I would just tell your listeners or really anyone, talk to someone who knows what they're doing. You can make it an easy decision, go with your company. That's easy. But really talk to someone who knows what they're doing. And then I mentioned this to you and I'll say it one more time. Your pain cream, the 500 milligram with the emu oil in it, I really think you guys have something special with that emu oil combination. We're starting to hear this in the literature, but I can tell you we see it personally, that pain relief as compared to something that someone's going to get from like a vitamin store here, it seems to be much longer with that emu oil. So that would be my only other thing. I really think you guys did a great job with that pain cream. So
well, thank you. There's actually there's research that's coming out about the synergy between the CBD and the emu oil. So there really is something there, and I'm excited that we have 3 products with it. So we're seeing the same thing. So stay on the line for me, but I'm going to go ahead and stop the recording. Thank you so much.
Of course.
Okay.